In this presentation, we're going to look at program evaluations, which is essentially research in agencies and communities. So we use the same research skills, concepts, designs that we use in academic research and that we've been learning all semester, but we just apply them to evaluating the programs. So first we have to determine exactly what a program is, and based on the book, the program is a set of activities designed to reach specific objectives and can be used to produce change at any system level. In social work, the programs that we deal with are always designed to improve some aspect of quality of life for the clients and the vulnerable populations that we work with. So what we have to do in an evaluation is we have to determine if the program works and what the evidence is for making that claim that it does work. If we find a program is not working, and oftentimes we do, there can be reasons for this, and the three most common reasons are: number one, the program was not delivered as was intended. When a program is designed and a mission is developed, a mission statement and goals, oftentimes the implementation happens and it wasn't implemented exactly what the vision was. And so that can result in a failure of reaching those outcomes and those goals. It could be that the actual theory of practice that we were using was wrong and that it just wasn't working. It wasn't getting the type of outcomes we wanted for the individuals we were working with. And it can be that the measures that we're using and the data that we're collecting might not be sensitive enough to capture the change that we're seeing. When we talk about measurement, we also talk about effect size. And an example of this would be if our program is meant to reduce the level of depression in a specific group of clients and we're using a standardized depression scale, it could be that that scale won't capture the small incremental changes our program is making. Maybe that scale will only capture large changes. So it could appear that our program is not working. Now, down the road, we have to decide if those small incremental changes that we are seeing are cost effective enough and have enough impact for our clients to continue, or will we need to revise the program to capture larger changes. But these are the three reasons why a program might not be meeting its goals and objectives. I'm going to say probably the first one and the last one are the most often seen. And the first one is seen more than you would think in terms of creating a program, designing a program, envisioning it, identifying the goals, which essentially are going to be your outcomes, and then implementing the program, but it's implemented in a way that was not designed and doesn't target the right population and doesn't carry out the right kind of services. So that's the fidelity of it. There are two overarching categories of program evaluation. There's the formative category and the summative category. And essentially, the formative category examines how programs are developed and implemented. Summative typically looks at the outcomes and the processes and the cost associated with those. And according to our book, formative evaluations is research that's conducted for the purposes of informing program improvement efforts directed at collecting information that can be used to target those improvement efforts. So formative evaluations, think about it as forming. And it can be done prior to the implementation of a program, often done after the implementation, or during, because there's also process evaluations. So we're looking at the forming and how the organization is formed, capturing data for that so that we can then use that in a feed-forward situation and target improvements. There's always improvements that can be made. No program is perfect, and we need to continually look at formative evaluations to make sure that that improvements are being made as changes are happening with our population, with society, with funders, whatever that is. And again, the summative evaluation judges the overall effectiveness of the program. And this again looks at the outcomes. And this gives decision making about the future of the program. Are we getting the outcomes that we expected? So can we continue to be funded? Should we continue to be funded? Should it be terminated? Is it so effective that maybe we need to expand it and duplicate it, kind of like you would if you had a franchise? So summative evaluations look at that outcomes, what's happening, and then they inform decisions about the continuation, the expansion, or the discontinuation of the program. So now we're just going to delve into some types of the program evaluation. And again, formative evaluations can include needs assessments, evaluability. I have a very difficult time saying that, but basically we want to know, is the program designed so it can be evaluated? Implementation evaluations, and consumer satisfaction assessments. We do a lot of consumer satisfaction assessments, and we oftentimes make the mistake that the results of those indicate the effectiveness of our program. But that is a formative evaluation, not a summative evaluation. So we'll talk about that. A needs assessment actually utilizes the research process and methods that we've been learning to determine if there, number one, does a problem exist and what the nature of the problem is, whether that problem actually warrants the implementation of a service or the continuation of a service, whether those services currently exist to address the problem already. Maybe the services are out there, but for some reason we are just not seeing the connection. And where a need exists, where is it within the community? Maybe there's some services in one part of the community that will address the problem in another part of the community, but without a needs assessment, we don't always see that. So we want to identify the most effective program to meet the need, and we use the needs assessment to be able to do that. And typically the questions for needs assessments include, what are the major social problems in a community? The extent of unmet need in that community. Are enough people in need to justify a program? This goes into some cost and some resources. Do people know about an existing program? Again, maybe there's something there that already exists. If you develop services, will people use them? Where should the services be located? What barriers prevent people from accessing existing services? And then how do the stakeholders view the need for new services or the usefulness of existing services? Stakeholders include everybody who has an investment in those services, whether it be a client, a consumer, a community group, retail people, whatever that is. All stakeholders need to be included for these needs assessments. When we talk about the types of information, first of all, we're going to look at perceived needs. And this is, what do people perceive that they need to address the problem that's been identified? Generally assessed directly from the people who are involved. And we do this through surveys, focus groups, community forums. So we want to hear from the potential consumers, the individuals who have the problem. What is this perceived need? And based on that, we can move forward in terms of being able to determine the answers to some of those other questions we just talked about. An expressed need is when the need is actually expressed as an action. So there's an action that's happening that we look at and we say, oh my gosh, there's a need for this. I think the example in the book talks about an after-school program. Maybe an after-school program is set up to serve 25 students, and every day there's 35 to 40 students that are showing up. This is an express need. We need to expand this program because there's more students who are wanting and needing this particular intervention. So it's an express need. It's expressed through actions. So we actually see that the need is real and there. So it's not just perceived, but it's expressed. A normative need is actually determined by individuals who are not using the services. This is often determined by regulatory agencies, by government statistics, things like that. So it's a normative need. So experts determine the need. We actually have Council on Social Work Education has a criteria that we have to have a 1 to 12 ratio in the MSW program, which means that we have to have one faculty for every 12 students teaching in our teaching. There's a formula for that because CSWE has a normative or has identified a normative need for closer faculty-student interaction at the graduate level. There is, in the state of Texas, there's a normative need that's been established through the legislature and by law that if a nursing home has 120 beds licensed, they must have a full-time social worker employed. If they have under 120 beds, they must have a social worker on contract. That is a normative need. So these are actually needs that are identified through other evaluations based on statistics, based on costs, based on perceived needs by politicians, by individuals, and then they're established and they're set typically by these regulatory agencies. One example that just came up recently is in terms of once we're licensed as social workers, we're required to have a specific number of continuing education units every 2 years to renew our license. This is a normative need. This is set by the state licensure board that says social workers need 32 hours of continuing education unit. 6 hours of those must actually be in ethics. So this has been established, and this is a perceived need. There is actually, as we're delving into this, because there's a conversation going on at the state and trying to regulate all helping professionals so we have the same amount of required continuing education. Psychologists have a different amount, counselors have a different amount from social workers, but trying to put our hands on research that indicates if continuing education actually makes a difference in practice competence, and if it does make a difference, how many of those continuing education hours, what's the quality of them need to be. This information does not exist. So somewhere out there, somebody perceived a need for lifelong learning. We understand that we have to continue to learn, so it's a perceived need for that, and then it is the need to change our behavior. We just don't have the research to show that. Need refers to comparisons. So a relative need would be looking at like a community in one area and seeing that they have this service being provided and that they have this number of individuals in this population and say, well, I have the same number of individuals in the population in my community, so therefore we most likely need the same service that they have. So it's a comparison, a relative need is. So we've looked at perceived need, expressed need, normative need, and relative need. So now let's look at the methods that we use to collect data in order to determine our needs assessment. And the one is surveys. And remember, surveys is the research method. Questionnaires are what we use to collect the data. And these can be done in a mailed questionnaire. They can be done in telephone surveys, face-to-face interviews. They can be done through the internet now. So conducting a survey gets you to a wide group of individuals and collects a lot of data for you, primarily descriptive data. That's what we're going to be practicing, is developing a questionnaire to do a survey for your research project in this course. Focus groups are also another common way of gathering information and data for a needs assessment, and this is where you bring together individuals who have similar qualifications, if you will, similar attributes, characteristics, and you actually have a prescribed questionnaire that you use, but you can also deviate from that questionnaire when you're interacting with the focus groups. A lot of times focus groups are recorded through Audible as well as through video, and then those audibles are transcribed later, and then the transcriptions from the focus groups are what are analyzed for the data. This can be done in a qualitative method, and it can also be done in a quantitative method where you can actually look for specific terms and needs and count those in there. So focus groups are also ways to do community needs assessments. A community forum is another way to capture information from communities regarding the needs. Community forums are different than focus groups, but community forums may bring in a variety of stakeholders and constituents to really examine what the perceived need is going to be there and to get the process started. So the community forum would include not only potential service users, but those who have a political connection, those who may have a organizational connection. So it invites a broader range of individuals to come together and discuss the needs for the potentially proposed problem or program. Key informant interviews is where you actually can identify and target those members of the community that are known to have expertise in areas. Key informant interviews are also important when you're looking at going into communities that have different cultures and being able to tap into those individuals who carry both a obvious form of power as well as more an inherent form of power in there. So key informant interviews are used individually, or they can be used in conjunction with some of these other methods to gather the information. Sometimes key informant interviews will be used first to actually get that information from those individuals, identify potential groups to engage in a community forum or a focus group or to conduct interviews with. So key informant interviews are often a great way to begin a conversation, especially when you're working in communities or with individuals that have minority status. And analyzing of existing records is also an important element for getting data to be able to determine needs surveys and put some numbers to those needs. And this can come from government census reports. It can come from police reports, anything that's going to be public information, court reports, maybe other agencies in the area that collect specific data. So being able to analyze existing records is also an important way to be able to establish and determine what a need is going to be, or if the need is going to be there for specific programs. So let's talk about evaluability assessment. And this basically says, is the program set up in a way that it can be evaluated? So it examines the clarity and consistency of the program's mission, goal, objectives, data collection plan, and measurement to achieve its stated goals. So it's evaluating the evaluation components, basically. Any program has or should have an established mission statement. From that mission statement, there can be a vision statement, there will be goals, there will be target objectives, and there has to be a way to measure that so they know if they're actually meeting those objectives. So in doing this type of an assessment, you go in and you look at the bones, the structure, the skeleton, to see if it's set up in a way where it can even be evaluated. Then when we want to look at foundations for effective program structure, then we'll look at process objectives and outcome objectives. In process objectives, we actually want to look at the processes that are in place, higher order activities of the program that have to be accomplished in order for the goals to be met. The outcome objectives is, are we getting the change in the participants that we say we are getting, or that our goal is to get? So the process objectives, are those there? The outcome objectives, are we meeting our goals? And the logic model for assessing this program evaluability is actually one of the best ways. It's one of the best tools to use to determine if program objectives are going to be measurable. If you're writing for grants, many grants require a logic model, and it's just a very succinct way for looking at inputs, the outputs, the measurements, the time frames. It's just a very nice, organized, objective way for doing that. So if you haven't used a logic model, you can Google some of those and see that. But again, if you're writing for grants, many of them will require some form of a logic model. We have implementation evaluations, and these are formative evaluations, and again, that focuses on the process and the activities that are established to implement the program. So we can be looking at quality assurance, and we can be looking at program monitoring. A lot of external regulatory agencies look at these processes to make sure that you have specific processes in place to manage the quality of the program that you're delivering, and that the program monitoring so that you have data that you routinely collect and that you analyze. Oftentimes when we're working in agencies, we're collecting data that the agency uses for regulatory purposes, and we don't even know what that data is being used for. You're asked to complete an intake assessment, and it's very structured and organized. That information then goes into the administrative assistant, or maybe you put it into a computer program. So that is going to be quality assurance as well as program monitoring data that's often collected. But these are important aspects to make sure that processes are being implemented. And these are, again, the things that regulatory bodies will oftentimes look at when they're coming in to do their assessment of an existing entity, such as if Centers for Medicare and Medicaid Services come in, Long-Term Care Authority comes in, they're going to be looking for these processes that would be in place. So an implementation evaluation determines if these are in place, if they're effective, if they're accurate, if they're producing the results that they're supposed to be producing. And then, of course, we have consumer satisfaction assessments. And pretty much everybody does some form of consumer satisfaction assessment. And what this does is this determines how satisfied the consumer is with the services, or if there's potential problems. And this is important because it doesn't give us the outcomes. It doesn't tell us if our program's effective, but it tells us if the consumer is satisfied or if they're having challenges in the program, because the consumer has to buy into the program, of course, to be able to have those outcomes. We oftentimes make the mistake of using consumer satisfaction assessments as a measure of the effectiveness of the program, and we don't want to do that. That's not true. It doesn't mean we're obtaining the changes that we say we're going to be obtaining, but it does measure the consumer's perceptions in terms of the services, the processes, what's in place, what barriers are going to be there. An example of this, a relative example of this, is within our own system, where every semester you're asked to do an evaluation of the courses that you engage in. And there's a portion on there where you evaluate the faculty, there's a portion on there where you actually evaluate the content, and then there's a portion on there where you actually evaluate related to our quality effectiveness program, which is our global aspect, and that's for a SACS regulatory entity. Those student evaluations are 1/3 of the faculty's annual evaluations in terms of our research, scholarship, and teaching. And it really is a satisfaction in terms of how well the processes and the faculty are working to provide you with the tools you need to be successful. But it is not evidence of teaching effectiveness. And so unless we do pre-test, post-test, unless we have some other measures in place, we really don't know our teaching effectiveness. We do know your perceptions of the satisfaction with it and how that works, but it doesn't measure teaching effectiveness. So we have to look at that very carefully, take that information. I use that information very strategically. I think it's very important information to help improve courses and delivery of courses every semester and grow through that. But I have to come up with other ways to determine if there's teaching effectiveness, and that means, are you leaving my courses with increased knowledge and skills compared to when you entered my courses? And that's a different form of evaluation. Again, that's an outcome evaluation. So when we start looking at summative evaluations, again, that's going to include the process and outcome evaluations as well as cost evaluations. And a process evaluation is an assessment of the activities performed by the organization and an assessment of the quality of these activities. We just touched on this in the couple of slides ago in terms of quality assurance and process evaluation. And we have to know that things are in place and that there's a quality of the delivery of those so that we know that if we are or are not getting the outcomes that we expect to get, does it go back to the processes that we have in place? So this is just another form of looking at a program. And ultimately, the outcome evaluation is where we want to see the evidence that the program makes the changes in the target population. We want to be able to say that our program is actually making the difference in terms of improving the lives of the humans that we're touching. So we have to have measurable outcomes. We have to have measurable goals. We have to collect data in the correct way. We have to have measurement tools that will be able to catch that, because this is one of the most important aspects of our programs and being able to go after more money, get continued money. The evaluations we've talked to up to this point are very important in ensuring that programs are set up, they're organized, they're being delivered in the way they are expected to be delivered. But ultimately, we want to know that the outcomes that we're making those positive changes in the target population. So they all have a place in program evaluation, and they're done at different points in time. Some are ongoing all the time. Some are done at the beginning of establishing a program and then within specified increments. But each one of them while they have a little bit of a different focus, they all utilize the research methods that we're using, that we're learning about this semester, whether it be a survey, whether it be a group research design, whether it be qualitative, whether it be quantitative. Research is research is research. We just determine the focus of the research, and then we know how to design the study. So it's the same thing with these different types of program evaluations. We have to determine what we're seeking, what's our question, how can we answer the question, who does our sample population need to be, how do we measure it, how do we gather the data, how do we analyze the data. The process is always the same. It just depends on the focus and how we change those components of those steps that we go. And another one is a cost evaluation. And cost evaluations can be cost analysis, cost effectiveness, cost benefit. And as social workers, we tend to shy away from this, but I kind of preach on this a lot because no matter what we're doing, there's a cost to what we're doing. You guys are earning your degree because you obviously want to help people, but you want to make a living. You want to earn a living at providing those services. So you need to get paid. And we need to look at cost analysis and cost effectiveness and cost benefit analysis to make sure that the programs that are being implemented and delivered are getting the most bang for the buck. So we tend to shy away from this. We want to think with our heart a lot of times, and we want to talk about, everybody should have access to everything and it shouldn't cost anything. But the reality is everything costs. Somebody's paying for it at some point in time. So most of the time we're being paid through a combination of maybe foundation dollars, tax dollars. If you get paid through Medicare or Medicaid, those are tax dollars. We don't generate a product that generates revenue, like if we built an Apple phone or if we built a computer or something like that, that generates revenue from an actual product. But the value we provide is in the impact that we have on individuals' lives. So we have to be able to put a dollar value to that. And that may seem cold and that may seem crass, but the reality is we need to do a better job of this because we need to be able to demonstrate the value that we are providing and how it does financially impact society, because this is the only way we will ever be able to raise the financial incentive for having social workers in agencies, in organizations. we need to put a dollar amount to it because we live in a capitalistic society, and those who are funding need to know that, for every dollar that's invested in mental health services, it actually saves $10 down the road in providing different types of human services. I think the last I heard, and I would have to look this up, it's been a long time, but I want to say in Head Start, for every dollar that's spent in Head Start, there's like a return on investment of $100 down the road per child or whatever, because that they are that much more ahead of the game in terms of their education. You have to have some long-term data in that, but we don't need to shy away from these. We need to be realistic, and we need to own what it costs to provide services, and we need to determine how to provide those in the most effective manner, the most cost-benefit analysis. This is how we run our homes, so this is also should be how we run our agencies. So these are other forms of program evaluations that are very important. And I think it's more important that we do our own and we don't expect regulatory agencies or other agencies to do it for us, because then we're giving away our power to make those decisions. So hopefully as social workers, y'all won't shy away from these type of program evaluations, and you'll embrace them and then be able to actually demonstrate to the public, to the stakeholders, to the funders, that an investment in what we're doing will reap a return on investment tenfold, hopefully. So a cost analysis is actually just determining the cost of delivering the program. What does it cost daily, monthly, annually to deliver this program? And that includes everything from salaries to fringe benefits, to capital income, such as, or capital investments, such as in terms of a building, in terms of a physical place to provide it, utilities, insurance, any of that. So what's the cost analysis? What does it actually cost to deliver the program? That's the lowest form of cost evaluation, is just the cost analysis. It's very descriptive in terms of what it provides. Cost effectiveness analysis, and that's a comparative cost of what it costs to deliver different programs and at different levels of the same program. So you're looking at what it costs for this particular program versus what it costs for this particular program in terms of the effectiveness of it. And this information is really good, especially if maybe you are in an agency that starts with inpatient, moves to intensive outpatient, then moves to long-term outpatient. You can do a cost-effective analysis of those different programs and compare it over time to determine, maybe you then determine that a shorter inpatient stay actually results in a cost savings down the road, because the outpatient effectiveness and cost effectiveness is more beneficial than what you thought. So this again is another way of looking at the cost of delivering the programs and the cost effectiveness analysis. And this gets into how much does it cost per person to get a change, a unit of change that you're looking at. How much does it cost per person to get them from, a level of depression that would consider them at high risk for suicidal ideations to a functioning level of depression. So there's a unit in there that you're going to attach a cost to. And then the cost benefit analysis. And again, this goes back into cost effectiveness and cost benefit, because we want to determine what's the benefit. What does it cost to achieve the goal that we're looking at? What does it cost to make the change in this person? And is that investment a good investment? Or how can we do it better? How can we do it more efficiently? We always need to be asking, what value are we providing, at what cost, and how can we do it more efficiently, more effectively, and provide more value for the clients? So this is what cost evaluations will tell us. And then the final evaluation process that the book talks about is participatory action research and evaluation. And this is actually where you engage the stakeholders throughout the entire evaluation process. And the goal is to provide them with the tools and the mechanism and the means to continue this even without your assistance down the road. So it's a form of self-evaluation, reflection, and it's a form of empowerment. It's oftentimes looked at as from a qualitative approach, to be able to actually go in and help individuals understand evaluation processes, all the way from being able to identify the need, to put the program into place, to evaluate how it was put into place, all the way through. So it's actually working, educating, training, and empowering people to do their own evaluations of programs. The benefits of program evaluation, it supports our professional ethics. We need to make sure that we're using evidence-based interventions, that we're not harming clients, that we're respecting the clients, that we're taking into consideration all the stakeholders in terms of costs and everything. So it supports our professional ethics. The program evaluations can influence social policy and practice. And again, we can use this information to advocate for, to lobby for different political decisions in terms of fundings for programs. It's obviously it has to be done to secure funding. Individuals have to know how you're going to spend their money, the effectiveness of their money, the return on investment. It's used to improve program decision making, and it's used to promote efficient services. So these are benefits to doing program evaluation. Oftentimes we think it's boring, it's, oh my gosh, I'm just here to help people. But this actually, doing the program evaluations, is a way of helping the clients that we're working with to ensure that they're getting the services that is going to make that change in their life, and to make sure it's being done in the most efficient, cost-effective way. The concerns, it uses valuable time and resources. It does cost quite a bit to do these program evaluations, to set them up. If you have skills in program evaluation, you can actually contract, you can have your own business, because so many agencies and organizations will hire outside evaluators. If you're writing grants, especially for NSF, they like an outside evaluator, because it provides a level of objectivity that may not be there if it's being done internally. There's concerns that it'll harm clients. And actually, I think that's kind of an erroneous concern, because if it's done properly, it's done to inform changes, inform positive outcomes for the clients. There's concerns that it'll harm social workers in the organization. We're afraid that there'll be misinformation, or something will happen, and then the organization will not cease to exist, or whatever. And then there's concerns that results cannot be trusted. And actually, if you use good methodology, if you use what's taught from the research perspective, the results can be trusted. There's obviously going to be some margin of error in there. But again, these are oftentimes ongoing processes. It's not a one said and done thing. You evaluate, you make changes, you come back and you evaluate those changes that are made. So it's an ongoing process, and it is very important that we engage in this. So if you have really good skills in research, you can become a program evaluator, and you can do very well in terms of financially, and then being able to serve programs out there so that they can do their evaluations and continue to be funded and continue to offer the services.